Hello, everybody, and welcome into another Virtuous Stay Well Health Chat. I'm Andrew Salciunas from 97.5 The Fanatic, host of Kincaid and Salciunas mornings, 6 to 10, Monday through Friday. You know the deal. And I love that I get to do this every single month, talking to another doctor from the team at Virtua Health on a monthly basis. I learn so much. My wife is in the medical field. My mom is in the medical field. So it's something that's also important to me and my family. And I'm really excited about today because I get to talk to Dr. Evan Blank, MD, board certified cardiologist and cardiac electrophysiologist, who specializes in treating patients with heart rhythm disorders such as atrial fibrillation, or AFib, as a lot of people know about it. And Doc, the reason why I'm so excited today, you're a graduate of the Icahn School of Medicine at Mount Sinai Hospital, which is where my sister went to college. And my wife works for a different hospital in the electrophysiology lab. So I feel like I'm talking to somebody who I already know. So Doc, welcome in. Thank you so much for coming in. Your resume is incredible. At Mount Sinai, obviously, that's a great hospital, a great medical program to be a part of. And you also completed your cardiology and electrophysiology fellowship at Emory University, where you served as the chief cardiology fellow. The longer the bio, the better I feel about you. The longer the bio, the more accomplished you are, and the better I know of a doctor that you are. You've published numerous articles in medical publications, and you've been presented research at international conferences. Dr. Blank, thank you so much for coming in today. I appreciate it, man.
Yeah, thanks for having me, Andrew.
So let's talk about AFib. I say atrial fibrillation. I know a lot of people hear about that on radio ads. They see a lot of TV commercials about it. It's also known, maybe easier for a lot of people, AFib, more common. So tell us what AFib actually is.
Sure. Yeah, thanks for asking. So AFib, or atrial fibrillation, if you really want a mouthful, is one of the most common heart rhythm disorders or heart rhythm problems that we treat in cardiology and in electrophysiology, which is my area of expertise and specialty. AFib is this irregular heart rhythm that starts in the top chamber of the heart. Just to review for folks, our normal heart rhythm beats around 60, 70, 80 beats a minute, and that's from a normal rhythm from the top chamber of the heart. And those beats go from the top down to the bottom in a one-to-one kind of manner. But in atrial fibrillation, it's really this chaotic rhythm in the top chamber of the heart that leads to sometimes fast, but always an irregular heart rhythm problem. And I think we'll get into some of the issues that can kind of arise with that.
Yeah, so how can I recognize the symptoms of AFib? Because I know me, if I eat like fried food at night, I'm usually waking up in the middle of the night, heart's palpitating a little bit. I take the sip of water, I take a couple deep breaths, and I go, all right, I guess I'm good. How can I recognize the symptoms of AFib?
Sure. So what's sometimes challenging is that the symptoms for AFib are different for everybody. Some people can notice palpitations, meaning that their heart is beating fast or irregularly. Sometimes people feel things up in their neck. They can even hear their heart kind of beating or racing. But other times people feel tired or fatigued because their heart is working fast and kind of working overboard. Sometimes people can even feel lightheaded or that they're almost going to pass out. Other times people feel nothing at all. And they're really the first time that they are told they have atrial fibrillation. It's kind of a shock to them. So it really can kind of run the gamut. Ways that people can find out at home, and we're seeing more and more, is people have Apple Watches and they're alerted that their Apple Watch tells them that they have AFib. And they certainly come with a lot of questions for their cardiologist and then eventually for us, the heart rhythm specialist.
Why is treating AFib so important? I imagine you're going to tell me something about how the heart is what kind of keeps us going. So why is treating it so important?
Yeah, so when we talk about atrial fibrillation, there's really two main things that we talk about. One, before we even get to treating atrial fibrillation itself, is the risk for stroke. The challenge with atrial fibrillation and why people hear a lot about it is because it does increase your risk for stroke. The reason why that's the case is that when the top chamber of the heart, instead of beating at normal kind of 60 or 70 beats a minute and squeezing, it's fibrillating. And what that actually means is that it's moving like fingers. It's really kind of jiggling and not really fully squeezing. And when that kind of happens, blood pools in the top chamber of the heart. And when that happens, clots can form. And if clots form in the top chamber of the heart, and if they break off and go to the brain, that's one of the leading causes for stroke. So even before we talk, when I talk to my patients about atrial fibrillation, before we talk about what are we going to do to manage their AFib, really first and foremost is managing their risk for stroke. Not everyone's risk for stroke is the same. The cardiologist will talk to their patients about what gives them either a lower or higher risk for stroke, but managing that risk of stroke is really important. That's why most people that have atrial fibrillation are either on a blood thinner to reduce their risk for stroke. It's never zero, but it lowers it down to basically the general population, or other devices, things called Watchman that we can talk a little bit more about, which may help people lower their risk for stroke without needing to be on long-term blood thinners. So that's the first thing, is really dealing with the risk of stroke.
So let's talk about all that. My doctor tells me, hey, Andrew, you got AFib. Whether I'm surprised or not, what's done about it? What are these steps that we take, sort of the initial steps? You're telling a patient right now, Dr. Blank, you're saying, hey, Andrew, you have atrial fibrillation. This is some of the steps we're going to do. What are those steps?
Yeah. So, like I said, we talk about managing the risk for stroke, and everyone's risk for stroke is different. Oftentimes people are started on a blood thinner. But then when we talk about managing atrial fibrillation, the real thing is, how do we get their heart rate and heart rhythm under control? So there's a bunch of different avenues that we have. It depends if someone's heart is going fast or going slow, if they're feeling it, if they're not. But oftentimes what we try to do is restore them back to regular rhythm. And the way that we do that either can be with basically a heart shock. It sounds extreme, but it's not. We have someone fully sedated and then basically give their heart a shock to put them back into regular rhythm. Other times we give medications to try to keep people in regular rhythm. And oftentimes what we're seeing more and more now is that folks are opting for an ablation. And I'm one of the ablation doctors. And basically that's a minimally invasive procedure that we try to eliminate the causes for atrial fibrillation to try to keep people out of AFib in the long term.
Now, you could speak to this much more than I can, considering you're the doctor and I'm just the sports talk radio host. But I think a common misconception is that maybe you're only overweight or you're only old if you have AFib. So who can get AFib, or like what could cause AFib for somebody? Because from what I know, it could be any age, it could be any race, it could be male, female, and it could be any sort of body type.
Yeah, so AFib certainly has risk factors. Everyone asks what caused my AFib, and there's never just particularly one cause of atrial fibrillation. We talk about the risk factors of AFib. The biggest risk factor is age. About 1 in 4 people above the age of 80 will have AFib in their lifetime. But that's not the only risk factor. As you mentioned, there are other risk factors, including being overweight, being inactive, people that have sleep apnea, that snore and really stop breathing at night, people that drink excessive amounts of alcohol that can cause atrial fibrillation. And then sometimes it just runs in families. So some people, everyone in their family has AFib. And then sometimes we don't have an exact cause for why you have atrial fibrillation, but certainly it's something that has to be dealt with.
All right. So you've now told me I have it. You gave me sort of the steps that we could take to try to help it. Now my lifestyle. Yep. Does it have to change? What modifications do I make? How can I change my life to try to make sure that I am taking the best care for my heart?
Absolutely. So, I think first and foremost is staying active. Atrial fibrillation should not interfere with your life or make you limit what you do. There are people who have AFib that are, high performance athletes. That's not every one of my patients. And certainly if you weren't running marathons before, you probably aren't going to start running them after you develop AFib. But certainly, we have steps to take, mainly ablation, to keep people back in regular rhythm. And then people have their own homework to do too. So working on losing weight, if people are overweight, helps to reduce the amount of time that they spend in atrial fibrillation, cutting back on alcohol, like I mentioned, and actually staying active. It's a common misconception that people think that they should not do a lot because they have atrial fibrillation. But in fact, staying active, at least 30 minutes of moderate amount of physical activity once a day has been shown to reduce the amount of time people have atrial fibrillation. And so it's really a combination of work that the patient does and then a collaboration with their physician to help them try to get back in regular rhythm and stay in rhythm.
Now, you mentioned 1 in 4 people who are above the age of 80 could get AFib. So Father Time's undefeated, right? What if you're somebody like me who's in their 30s, or somebody is in their 20s or 40s or 50s? Is there a way to reduce the risk of AFib or any sort of heart disease? Because we're not just totally destined for it. You mentioned sometimes it just runs in the family. But what are some things that we can do ahead of time instead of just being waiting to be told by a doctor that we have it?
Totally. Yeah, I think managing those risk factors. So, making sure your blood pressure is under control, making sure your stress is managed, leading a relatively healthy and active lifestyle. All of that helps to reduce the long-term risk of developing AFib. Okay, and it's just good for things overall,
Yeah, that's simple enough. Dr. Blank, listen, I appreciate it. The heart, very important. So we want to get this taken care of. There's ways to obviously prevent it, and there's obviously ways to take care of it. If you got enough information from watching this video, fantastic. But if not, you can always go to the Virtua website. Go to go.virtua.org/heart consult. Again, that's go.virtua.org/heart consult. And you'll be able to see a lot more about the programs that Dr. Blank is a part of and the entire team at Virtua. Just go to the Virtua website in general. You'll learn a lot about what they provide for you in all sort of medical fields. So, Dr. Blank, I really appreciate you taking the time today. It's a very important part of our body, and it's something that people need to maybe, especially in the new year. We're still in the early part of the year. We can start working on those goals a little bit for the rest of 2025. I appreciate it.
Absolutely. Thank you, Andrew. Thanks for taking the time.